Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Let's go!
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, baby, that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become a better you, to be the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
Well, good morning, everyone. I'm Jackie.
And Coach Patrick.
Welcome to Health Matters, our podcast where your health matters.
Yes, every day. Listen, we want you to join us right here every Saturday at 9 a.m. as we bring you relevant information pertaining to your health and well-being. We'll have healthcare professionals and other professionals on the show to assist us in helping you to be the best you that you can be as it pertains to your health and well-being.
So, guys, you already know what to do. Head over to the Facebook page, Get Fit with Jackie Fitness, and like our page. Also, go ahead and subscribe to our YouTube channel at Jackie and Coach.
Health matters.
Yep. Health Matters, Jackie and Coach.
All right.
All right.
You get applause for getting it right.
Oh, that's all right. That's all right. Well, good morning, everyone. You know, guys, we're still we moving through and recovering and trying to rebuild and restore back, you know.
From
So
Hurricane Helene.
oh God, I call her Helena.
Yeah. And Florida just is going through
Right.
Hurricane Milton. So we're praying for them that
Yes.
everyone gets through and be okay.
Right. And we hope this one Nadine die down in the trying
Most
to brew up.
definitely.
But guys, we just thank, God for, life.
Yeah.
We're here. We survive. Things can be replaced.
Yes. That's the most
Houses
important
can
thing.
be replaced, but a lot of people lost their homes. A lot of people
Mhm.
lost loved ones,
Most definitely.
So we always have someone may have it. We look at our circumstances, but we always also have someone maybe going through even worse. So
Yeah.
we always, even though we're going through, we can still extend and reach out.
That's
But
right.
there's massive support from all over. People are coming in and providing resources and
Mhm.
things. So
And help for people.
and-
Most definitely.
and that's a good thing. So
Most
guys, we
definitely.
just continue to get through this because Augusta have not experienced this.
Yeah. We used to
before.
just get the high winds and rain, but
Yeah.
we got some very high winds and a
Yes.
lot of rain this
Yes,
time.
yes.
But we're gonna be all right. God's gonna
Yes.
get us through it. He's still on the
Absolutely.
throne and he still does what he do.
Amen.
And he'll
Amen.
never leave or forsake us. Happy birthday to everybody that's celebrating a birthday this great month of October. My very own Jackie is celebrating her birthday this month. All
Yeah.
right.
Woo. Yes. Also, my daughter is going to be
Yes,
celebrating her
yes.
birthday. I tried to have her on my birthday, but she came 2 days after the 21st of October.
Happy
That's the good
birthday,
thing.
Dee. Love you, baby.
Yes. Also,
Our niece, Princess.
yes, we
Isn't it
celebrate
her? Yeah, she's celebrating the birthday.
on the
this month.
17th
Sure is.
of
Yeah.
October, as well as Patricia Lee, a
Happy
friend of
birthday.
mine's. Happy birthday. And anyone
Happy
else that's
birthday.
going to be celebrating a born day this month. May you enjoy your day, enjoy your born day, enjoy yourself, do something to take care of yourself and show yourself some self-love.
Most definitely.
Celebrate
Celebrate
yourself
yourself.
like you celebrate others. Okay,
Celebrate
don't leave yourself off that priority list.
Right.
Yes.
And happy anniversary to anybody that tied the knot, jumped the broom. However you did it, you did it.
Yes.
Just enjoy
yes.
each other, enjoy life, and build memories and build family as you become one.
Amen. Amen. Amen.
Happy anniversary. You know anybody having an anniversary, Jack?
The Christoph, Marietta and Christoph,
And Roland.
they're
Okay.
Roland. They're celebrating 47
Wow.
years
Happy
of marriage.
anniversary.
Happy anniversary.
Hey.
Guys, we
Alright,
have to
man.
applaud that. I'm
Most
telling you, have to
definitely.
applaud that. Yes.
So we're going to
absolutely.
recognize our sponsors Aiken Chiropractic. Dr. Dan, when your spine is aligned, your body is too. Aiken Chiropractic is located at 425 Lawrence Street Northwest in Aiken, South Carolina. Their number is 803-641-9191, and their website is www.aikenchiropractic.com. To be a sponsor, to be a partner or friend of the show, you can call 706 592 8862. We would love for you to help us do what we do on a weekly basis, and not just that, to help us do what we do in the community by bringing free chronic disease management and prevention programs into the community free of charge. You help us to do all those things when you're our sponsor, when you're our partner, and when you are our friend. Yeah.
Yes.
And
And that's
talk
what we
about
do.
Dr. Dan. We got Dr. Dan coming on the show, right?
Yes. So, guys, this is spinal. Even though it's Breast Cancer Awareness Month, I want to encourage women to get your mammogram. Make sure you get to know your body. Also, make sure you're checking your body, checking the areas, look for different signs. Know the signs. There's like 11 signs, 7 or 11 signs of breast cancer. So, we want to make sure. And also now, if you have dense breasts, you now able to, under your insurance, to get a what you
3D,
call it,
is it?
3D exam, which is called, for they kind of spread it out. It's not a normal mammogram, so they go a little bit deeper. So you can do that. You may want to talk to your doctor about that. So guys, make sure you are checking your body and how are you feeling, and if something feels off or something feel different, it's not always pain. So just make sure you doing your mammogram. Do buddy checks. Make sure you check up on another lady. Also, make sure now, Get Fit with Jackie Fitness and Wellness, we support women getting mobile mammograms free. So every year, with um, I believe organization, we give back to the Piedmont um, Hospital of the Miracle Mile Walk. So we have raised over $2,000.
Well,
So
yeah,
12, yes. So
2200.
$2,200. So every $200, a woman get a free mobile mammogram. So that's a good thing. So I always wanted to, give back. I am a 17-year survivor. So that's my way of giving back.
All right.
So to the community. So I just wanted to kind of get that out there. But it also is health care, spinal care month. So Dr. Dan's gonna come on and he's gonna talk about. So with no further ado, we want to introduce you guys again. Always our doctor, our sponsor, Dr. Dan Dolan.
All right. Hello, Dr.
All
Dan.
right.
Welcome to the show.
Hey everybody,
All right.
how you guys doing?
We're doing good.
We're
How about
doing
yourself? We're
great.
shaking off the dust, shaking off the trees, and
The
Yeah,
debris.
everything. I
yeah,
said,
yeah. Well,
Yeah.
yeah, that was really bad. We're gonna do a little different this morning here. As you know, this whole catastrophe affected CSRA, and even worse in other areas like in Western North Carolina and East Tennessee and probably Florida as well. So I consider ourselves lucky that we are still here and we can still function. So
yes.
it
Amen.
could have been worse. So but I still don't have internet at my house. So, I had to go
That's
somewhere
good.
else and do this because there's internet here. And I thought we'd do a little something different. And hopefully everything will go back to normal. I just want to take an opportunity to say, wish everybody the best. I hope, they can rebuild if there is any damage, and hopefully they'll get some, help from, I guess, insurance or FEMA or what have you, if needed. And the most important thing is health, and hopefully we're all good. And if it's materialistic problem, well, that can be rebuilt at some point. So we gotta look at the positive part of this whole thing.
Most definitely.
We had some problems. My office is running in Aiken, and also the two I have in Augusta and Evans. But in Aiken, we do not have internet in Aiken either. So our phones don't work right now. They might be working soon, but right now they don't. So if somebody wants to call the office or make an appointment or what have you, please leave a voicemail. Because if you leave a voicemail goes into email, and we will, see that, and then we can call you back from our cell phones. That's what we've been doing. But if somebody just, hangs up, we will never know they called because the phones are not working. So hopefully next week it will work, but who knows? They keep postponing the date of that stuff. So let's just kind of hope for the best. But that's how it is right now. As you probably know, I have an office in St. Pete, Florida, as well for 12 years, and that office got messed up. It got flooded, and some stuff has been, destroyed or ruined. We're in this, business building, and there are other businesses in there. And we don't own the building. We're
Mhm.
just one location in there. And yeah, they're working on it right now. Where we
Mhm.
can open, we may not be open for a while there. I don't know, but they have to redo the roof, the walls.
Mhm.
It's crazy.
Yeah,
So that
absolutely.
got a lot worse than here. So we'll find out. But right now, I'm staying here. I'm working and providing care for people that come. But it's not easy. So we're just happy we're alive.
That's it.
Amen.
And congratulations for your birthday, though. That's nice. And your daughter, I didn't realize that. Mine is coming up in December, so
Awesome.
Okay.
I'm not far behind you.
Yeah.
Um, and as far as the cancer is concerned, of course, people need to take care of that and do mammograms and all that stuff. But they also need to do a self breast examination. They should know how to do that. If they don't, doctors should show them how to do it. Mammograms are yearly. I just want to make a point that sometimes the cancer advances quicker than you get the next mammogram.
Mm.
So, sometimes it's already kind of developed before you get a next mammogram. So, women need to know how to do a self breast examination. And if they feel any kind of lumps, they need to make an appointment and get examined properly. You just never know. It could be benign, but then again, it could be cancer. We had this year, we had two of our staff members in our Augusta and Evans clinics that had breast cancer.
Mm.
So it's crazy. And you know one of them, Dr. Desiree.
Yeah.
She's dealing with
Yes,
that right
yes,
now,
yes.
and she really can't work. So it's kind of hard on her. And there
Mm.
was another staff member as well, not a doctor, but another staff member, and she had to go through chemo and everything. And so she's actually, back at work, but she had to miss something like 6 or 8 months. So we helped her out as well. So it can happen at any age, and
Oh
they're
yeah.
certainly not all there in their 30s. So anything can
Mm.
happen. So take that seriously and do those yearly mammograms, but also make sure you do your weekly breast examination by yourself. If you're not sure how to do it, ask your doctor. They will show it to you, and you need to feel for any of the lumps or anything like that. So that's really, really important.
Most
Now, since I do chiropractic, this
definitely.
month is also a Spinal Health
Spinal
Month,
Health Awareness Month.
and it doesn't get as much publicity because it's the same month as breast cancer, which is a big thing. But let's talk about spinal health and everything else. And I think we did this last year. I like to take a moment and talk a little bit about a history of what we do and what chiropractic really is and everything else. We talked about it last year and all that, but
Yes, we
I
did.
thought I do a little different. So I'm sitting in front of this big screen TV here, and I wanted to pull a video. And there is this is on YouTube, and you can find this stuff. But who's better to explain, what chiropractic really is than one of the people that started chiropractic in this country? And I found this interview, which was on the radio. This was in 1931. So this video
Wow.
we're gonna watch for a few minutes and let the doctor explain it. The doctor's name is B.J. Palmer. That's on this video.
Mhm.
He is a son of Didi Palmer, and Didi Palmer is credited as the founder of chiropractic in United States, and I would think the world as well. But chiropractic care really existed for thousands of years. It was just not called chiropractic. People will, they were doing stuff to the spine. People had spine related problems, for as long as the humanity exists, really. They have found drawings in ancient China. They're 3,000 years old or older on like different, I don't know, it's like ceramics or what have you. And it depicts people, treating each other, kind of like what we do today, except they didn't call it chiropractic back then. I don't know if there was a name for it, but they were
Wow.
resetting the spine and adjusting the vertebrae back in place and all that. So chiropractic as a term is newer. It started in 1896 in United States. D.D. Palmer, kind of started that as a science, because up until then, it really wasn't a real science. People kind of knew how to do it and kind of did it. They were moving bones and all that, and he helped people, but it didn't really make it a science. And then he came along and he made it into a science. And so, he gave it the term chiropractic, chiro meaning hands, and practice to practice with. So we're supposed to use the hands in a practice, although today we have instruments and we have all kinds of other things, but, because it's developed a lot more. But this is his son, BJ Palmer, which I think is pretty cool. His full name is Bartlett Joshua Palmer, or BJ Palmer for short, and pretty cool guy. I mean, so D.D. Palmer was a founder of chiropractic in United States, but BJ Palmer was a developer of chiropractic. So he was more into science of it. He developed some machines. He did a lot of research, and he kind of wanted to see why that works the way it does and kind of prove it, why that happens. And actually, he owned the chiropractic college, which is still there. It's called Palmer College of Chiropractic. It's in Davenport, Iowa. That is the oldest one in the world that I know of. And everything else came later. So the doctor that started the chiropractic school that I went to, which is in Atlanta, it's called Life University College of Chiropractic. That his name is Dr. Sid Williams. He has passed on, but I actually met him when I was in chiropractic school, 20 some years ago. He was still alive, and I was able to actually see him and everything. And he was already in his 80s probably, but he was still very coherent and did some speeches and stuff. And so he actually studied chiropractic at Palmer College of Chiropractic, and then he opened up his own school. And that's how most of the other colleges have started in United States and other parts of the world. But anyway, the original one is in Palmer. So here's the video that I thought was interesting. And let's kind of see what he says. And I'll let Dr. BJ Palmer explain what is really chiropractic. I think it's pretty interesting. And this was in 1931, and chiropractic in this country started in 1896. So it's been around a long time. And this video is, it's 2024. That's, almost 90 some years old, So, but look what the guys did. All right.
Pleasure to introduce to this radio audience Dr. B.J. Palmer. Davenport, Iowa.
Pretty cool.
He's the only son of D.G. Palmer, the founder of chiropractic. Dr. Palmer has developed the principles and practice of chiropractic and is the world's foremost authority on chiropractic. The subject is, what is chiropractic? Dr. Palmer.
The adult spinal column consists of the superior 24 freely movable bone segments called vertebrae, together with the sacrum and coccyx. All the great nerve trunks emit through the openings between these vertebrae, known as intervertebral foramina. The vital nerve force within man is carried by these nerve trunks from the brain to the various organs, muscles, and tissues of the body. For every effect, you must have a cause. That is fundamental. If a person is sick, then the condition of dis-ease, regardless of the name applied, is in effect for which there must be a cause. The chiropractic premise is that the cause of dis-ease is due to the subluxation of vertebrae, which produce pressure upon nerve trunks and thus interfere with the normal transmission of vital nerve force. The chiropractic objective is to locate the points in the spine where nerve pressure exists due to subluxated vertebrae, and by proper adjustment, restore such subluxated vertebrae to their normal position, releasing the pressure on nerves involved, and thereby removing the cause of dis-ease in the body. Most of us are born with bodies that possess normal organs within. As long as they function properly, they give no concern. It is when normal function is disturbed that we become sick. For our body to be healthy, it must receive vital nerve force in proper quantity and quality through the nerves. The practice of chiropractic embraces this essential. The expression of this vital nerve force in the body depends upon the condition of the nervous system, because that is the medium through which the vital nerve force is transmitted from the brain to all parts of the body. If an abnormal condition or sickness occurs, it is due to interference with the normal transmission of this vital nerve force between the brain and the tissue cells of the body. There is only one place where this interference can be produced: in the spine, where the great nerve trunks pass out between the vertebrae. When a vertebra becomes subluxated, the opening through which the nerve trunks emits is constricted, and this constriction produces pressure upon the fibers contained in that nerve trunk, so that vital energy cannot be transmitted in normal quantity. Every fiber impinged by this constriction supplies some tissue cell, and that tissue cell is abnormal in the same degree that the fiber is pinched. If many of these fibers are involved, then many tissue cells are involved, and they remain in a diseased condition until such time as they again receive their normal quantity of vital energy. For more than 36 years, chiropractic has been getting sick people well. From a rudimentary beginning, it has grown and developed into the foremost health science. Thousands of men and women who have practically given up hope of being restored to health have been made well by chiropractic adjustments.
Isn't that cool?
Good stuff.
Awesome.
So this is just amazing. And at the time of this interview on the radio, they had it going on for 36 years, and that was in 1931. And
Wow.
look at it now. And look at this picture. I mean, this is some chiropractic class, probably a Palmer, long time ago. It's a black and white photograph, and you can see they're actually treating patients right there. And they're all kind of studying and everything else, and they wear all these white coats and everything. I love how they all dressed up with their little, ties and everything else. But
If I
yeah,
remember correctly, Dr. Dan, I remember you
Uh-huh.
sharing that they used to have chiropractic hospitals, a whole
Yes,
hospital for chiropractic.
yes, and I was going to show that as well. Actually, here, let me show that next, because that's actually pretty neat. The sound is not the best, but this is again an old video, and you'll see that. Look at this.
One of the finest and most unusual health institutions in America. This is the famous Spears Chiropractic Hospital, mecca of health seekers from all over the world.
It was huge.
Located on 15 acres in the heart of beautiful Mile High, Denver, Colorado, with the magnificent Rocky Mountains in the background. Denver is rightly called climate capital of the world, renowned as a health center because of this incomparable climate.
Wow, look at that big
Clean,
building.
dry mountain air,
Wow.
sunny days year-round. Great factors in restoring patients to a pleasurable state of mental and physical well-being.
Wow.
You're never a stranger at Spears. Visitors are impressed at the size and beauty of the grounds and buildings even before they enter the 600-bed hospital. This is the
600-bed hospital.
600.
So-
Wow.
And that wasn't the only one. I mean, there were plenty of other ones. And if you watch the video, this is called Spears Chiropractic Sanitarium and Hospital. That was the actual real name, Spears. So it was a Dr. Leo Spears that did this, and so it was huge. I mean, he just said he had over 600 beds. I mean, this was a big operation.
Mhm.
This happened to be in Denver, Colorado, but there were others. So what they did, they actually called those things sanitariums as well, because they were treating people not just for physical ailments, but also mental and emotional. So it wasn't just chiropractic. Chiropractic was, I would think, the important part of the whole treatment, but they also did it through diets, probably exercise, just try to do everything natural and get rid of all the, toxins in the human body. And they had a huge, isn't that cool? It was all encompassing. It wasn't just one thing. and they had a huge, positive success rate. When you actually look this up, I'm not going to do it now, but there's all this stuff is on the internet. Um, if you look at the medical, sanitariums sanatoriums, whatever they're pronounced, for mental health back in the day, they had very low success rates. Something like only 20% of people that went there actually were able to reintegrate into society. They were pretty much putting people there forever, almost like some sort of a prison, so they don't walk around like crazy people. But these guys in this sanatorium and some other chiropractic hospitals like that, their rate of reintegrating people back to life was over 80%. 80%. So that was amazing. And so, that's what it did. So, how come we don't have that today? Like, what happened with all these big hospitals? Well, these big organizations need a lot of money. I mean, this is not free to have something that size. I'll play the video without the sound so they can see how interesting the building was and everything else. But, it takes a lot of money. So I don't know what year this was. I couldn't figure it out. This was later. It might have been in the 50s or 60s when you look the way they're dressed and the cars outside. That wasn't 30s. That was a little bit later. So it was, later on. But what got them going at the time? They were getting, federal funding. They were getting money from the government. They were getting grants and everything because they saw the benefit of this, and they were giving them money to keep it going, and it wasn't just for people with insurance, and it wasn't just, I don't know if they even had that much insurance in those days, or people that can afford it. So the government was able to, help fund for these things. And then what happened? I think in the 70s or something, companies got greedy. Insurance companies, the pharmaceutical companies, they didn't want to treat people like this. They didn't want to treat it with natural methods. They wanted to, have everybody be hooked up on medication. And so, so they lobbied. They lobbied successfully, I might add. It took them, a number of years, but they lobbied to government to stop funding, this kind of hospitals. They're, treating people in a natural way, and they were successful. And the government stopped paying for it, and all of these places went out of business one after another because it's so expensive to keep something like this going without, government help. Our government helps a lot of other, healthcare, providers and hospitals. And also, the pharmaceutical companies. I don't know if people know, but pharmaceutical companies get free money every year in the tune of billions of dollars, and those are grants that they don't have to pay back. And the idea is sound. The idea is that they will use the money for research to come with what they call breakthrough medication, something new, to treat something new that we haven't been able to treat yet. The problem is the pharmaceutical companies got so they got so good at this. All the medication that's new, 95% of it is still old stuff. Nothing's really new. They just repackage or change the formula a little bit, but the active ingredient is the same. So they just, the game is that you gotta be able to come up with something new so you can get new patents. And if you get a new patent, then you are the only one, they can produce that particular drug for 10 years, and you can set the price whatever you want. I mean, how come a pill is, $600 a pill, and then 10 years later, you can buy a generic version of it, which is the same thing, and it's 50 cents a pill, They're making huge profits, and they're also using the free money from the government to do research, and they're not really researching a lot of new stuff. Everything's still the same. And what also bothers me as well, we talked about cancer, and you are donating money for mammograms, which is phenomenal. I donate money through my businesses all the time, but what's going on, if you read it, you can Google this. Now they say for all the money that we all donated for cancer research over the decades, only maybe 6 or 7% of all that money actually was used for cancer research. Can you believe it? Yeah. Everything else was used for, people took it. I mean, they took the money, and it's amazing. It's amazing how much money has gotten wasted or went into, wrong pockets, as opposed to, so, whenever government gets involved, something always goes wrong, because there's people are corruptible, and they
Mhm.
always find ways to kind of make that upside down and
System, yeah.
not make it the right way. So that's why I believe in free market. I think the free market economy is the best system, because the market would correct itself, because if you need to make an income to pay the bills, you're going to do the best you can, to serve people, so you would make that income. But with the government, you get free money, and it's just a way of seeing how to hide that, so that can be squandered away. But something like this Spears, look at this. That's all scenes from the Spears Hospital. What I did, it's all based on normal medical stuff, and instruments and everything, and they did natural things, and they tried to do all the tests and everything, and then chiropractic was part of the care. So wouldn't that be great if we had this today?
Yeah, so
Chiropractic.
that's what I wanted to
Yes.
ask you, Doctor
Yep.
Dan. So it's a 600-bed hospital. So
Yeah.
like when you treat people today, they're in and out. But when
Yes.
they went to this facility, I take it was for maybe a stay, like a week or 2 week stay or something.
Yes, well, it was a different way of working back then. Today we have to do it the way we do, because that's just the way it is today. People have to pay on their own, and they can't afford to
Mhm.
just stay somewhere and pay. I don't know how much it will cost to stay somewhere in the hospital overnight, but that's a lot of money. But look at all the stuff they did back then, and that's why they needed money and funds to keep that going.
Mhm.
Today, of course, our care is very affordable. They can come in, they can get treated and leave. It's outpatient based.
Right,
So
right.
it's very good. Chiropractic is now present in all the VA hospitals. All the veteran hospitals have chiropractors, and I actually treat VA. I treat veterans. And the way that works is, they will have to go to the VA hospital at least once, and then basically ask for chiropractic care. And
Mhm.
then
For referral.
if they live, say, in my area, like around Aiken, but VA hospital is in Augusta, they don't want to drive all the way to Augusta every time for treatment. They can just say, hey, well, can I go somewhere closer? And then they will look people like me up and say, okay, you can go to so and so, because And then what happens is they would fax me, how many treatments they allow, how many visits they get, and all that stuff. But it's they don't have to pay anything, so the
Mhm.
VA kind of can pay us as well, even though I don't work for VA, but they do pay for those things like that. So there's programs, and also there's a reason why Medicare pays for what we do. Medicare has done a lot of studies on this, chiropractic treatments. Long time ago, this was a RAND study. It was a short. It was 4 words, RAND. I don't really know what it stands for anymore, but it was called RAND study for short. And it took years for this study. It wasn't like studying like 3 months. It took, I think, 5 years or something. So they looked at people with different conditions. Look what they're doing with this hot bath and everything. That's pretty neat. They did studies, and people with certain conditions, they underwent chiropractic care, and then they also went into typical medical care, and the
Mhm.
results were stunning. The government found out with this study that if you go to chiropractic care versus standard medical care, you will get results there. First of all, you get faster results. The results are longer lasting. Um, it would be, what's it called? It's painless and everything. And the fourth thing, and this is really why Medicare pays for this, is they're cheaper. Our care is a lot more affordable
Mhm.
than the standard medical care for the same conditions. So,
Mhm.
that's where Medicare started paying for chiropractic, and that was probably in the 80s, I would think. I don't know. That was way before my time. But Medicare has been covering chiropractic for a long time, and same thing with Medicaid. But we could lose those benefits because of politics, politicians, and lobbying and all of that stuff. So everything the government gives you can also go away if you don't fight politically for the rights, just the way it is. So people are looking for our care. We actually see quite a bit. More visits every day than standard medical doctors do in general. You can Google that on the internet as well.
Mhm.
Uh, but people are looking for natural care. They want something. They don't want side
Right.
effects of chemicals and all that. Look at all that. Look at all this treatments they were doing back then. That's so interesting to see all that. Of course, we have more better stuff now too, But it's just pretty impressive to see that this was happening in the past, and for some reason now it's gone. It's just money. And if we're not careful, we can lose even more rights and even more things. So we need to be very careful, what these politicians are doing. I got involved for a little bit. I'm a member of Chiropractic Association in South Carolina and Georgia. Um, I don't think I am in Florida because I don't really go there that often, but I am. I have license in all three states, and I do donate money to them because those are the bodies that actually fight for our right to exist and to treat people. And when I was in South Carolina a few years ago, I was a district director for Chiropractic Association here in my district in Aiken area. So I made meetings with docs and everything. We discussed things, and then I was also on the board of chiropractic in Colombia. So I had to go to the meetings every so often and see what's going on the legislative side. And I'm telling you, they're attacking our profession constantly, and we need to be vigilant. So the public doesn't really know, because how would you know? They don't really, publicize that kind of stuff.
Mhm.
But they're attacking it all the time. And if we don't stand up for ourselves, nobody else will. So we're trying to fight for us to practice and for our patients to have access to the care that we provide. It will be a really sad day if all you got is just chemicals and medication. You don't have anything natural anymore. That'll be really sad. So that's why I'm really adamant about a little bit of a history, because we fought throughout our existence as a profession for the right to exist and have this, be able to do what we do. And it was really cool. I mean, this was, a long time ago, and they did some pretty cool stuff for people back then. So anyway, that's why. And for instance, when COVID hit in South Carolina, we were able to continue to practice. We were considered essential providers, and Governor McMaster sent a letter to all of our members at the Chiropractic Association. So I read it as well. And basically, in the letter, he said, "Hey, please continue seeing patients. We don't want you to stop, because people are still going to have the same issues. And if you don't see those kind of patients, they're going to end up going to the emergency room. And we don't want to have our doctors overwhelmed with, regular problems. They want to be treating COVID. So if you keep seeing those kind of patients, you would take the pressure away from doctors that are treating COVID." So he's like, "Please continue working." So we were considered essentials, and we worked. It was the same thing in Georgia. But it wasn't like that in every state. In some states, everybody was shut down, including chiropractors, and it was political. It was just, there was no
Yeah, everything
scientific
was
reason.
political.
Yeah. So I learned just this year. I did not know that. I thought McMaster somehow knew that we were supposed to be essential and all that. But when I was at the convention in Myrtle Beach this summer, actually they told us no. Chiropractors were not listed as essentials in the beginning of COVID. He
Mm.
wasn't going to make us essentials at all. And when our Chiropractic Association noticed that we were missing on the list, they called in and they said, "Hey, wait a second. Chiropractors should be essential because they provide really important service." And guess what? McMaster, when he heard that, he reconsidered and he added us to the list.
I
But if
see.
they didn't say anything, we will not be essential. We will not be able to
Wow.
provide the service. And that happened in other states. Like my best friend, he is a chiropractor in Denver, Colorado, where the big hospital was back in the day.
Mhm,
And
mhm.
Colorado is really big on chiropractic. But for some political reasons, when COVID hit, the governor there decided that, hey, you cannot work. And so the chiropractors were very upset, and they tried to again talk to his office and say, "Hey, how come chiropractors are essential in other states and we are not in Colorado? We provide a really important service. We should be essential." And their governor did a very sneaky thing. He basically said, "You know what? I agree. You should be essential." But he made it in such a way that he wrote that order. He basically said, "You're essential, but you can only treat people if you can prove in your documentation if somebody doesn't get treated, we're going to die. Like it's life threatening." and we
Wow.
don't see people they're gonna die tomorrow. So it was kind of really, really bad.
That's
So
that red tape they put
yeah,
in.
it's just politics. I mean, that's nothing to do with practice of chiropractic or anything like that. They know very well that we're not emergency room kind of people. You're not gonna die the second, but you're gonna be very uncomfortable and have a lot of pain. But
Hmm.
you may not die from it.
Right.
But so that's how he did it. And my friend couldn't practice for something like 3 months or something, and then he let him practice. And I mean, that's just politics, and that's why we need to be vigilant and make sure that people like this lady, like in this video, actually get the care that they can have. It's just
Mhm.
ridiculous that some of these things are politicized, and I disagree with that. I also disagree now that we're talking about this stuff with when they talk about abortion. Why is that political issue? Shouldn't that be between the patient and her doctor, right? Why are these people even jumping into that? I think that is a something that should be discussed with a healthcare provider on each case basis and see what's important and all that. I don't know why all these people are so upset about it. I feel like that should be something that healthcare will decide and not politicians.
Well, these
But
days everything is made political. Even the
yes,
hurricane is made
it's so
political.
political, and I'm really sick of it. And
Mhm.
I don't really like it. I don't really like, either side. I think they all have some good things and some bad things, and I
They
don't know
have
why
their
they can't.
agendas. Yeah, they
Yeah,
have
why
their
can they
agendas.
meet in the middle and put the people first? We as people should come first, and our needs should come first. But unfortunately, that's not the case. There's a lot of bad stuff out there,
Mhm.
and I'm scared. I'm actually concerned about the future of our country, and I just don't really. I don't know. I've never been concerned like this before. But
Mhm.
somehow, right now, I feel like we are very at the tough spot,
We
in our
are.
history.
We are.
So, like, look at this video we've been playing this whole time. It's so cool, and that should exist, but it doesn't. It doesn't anymore.
And the thing
And
about chiropractic care, like you said, Dr. Dan, is
mhm,
natural, care.
yes,
Holistic care,
It's
and
and
that's they go against holistic
right.
care because
yeah,
you can. I believe it.
It gets in their pocket. I mean,
Right.
yeah,
you with the pharmaceutical, you got the doctors, you got pharmaceutical. It's just
yeah.
a vicious circle of people that is involved in the big money, so
It
that's
is,
why they
and
rather do it that way than do things a natural
it
way.
is.
They don't
It,
make money off of holistic, so they're not
yes,
going to
yeah,
use that as a preventive, or
yeah,
because the body can heal itself if
yeah,
it's given
exactly,
the
and
right treatment that it needs, and when you know
exactly,
what to do. But of course, you know they want to.
exactly. Well,
Politics.
That's a whole
you
nother conversation.
Yeah. If you're the one that's trying to promote the natural healing of the body to occur, then something's wrong with you. Like the proper something's wrong. But
Right.
in reality, body heals itself. That's what it does. What it requires in order to do the healing is the absence of what's causing the interference. And so if you remove that interference, body has all the mechanisms and all the chemicals it needs to survive. It just needs to get rid of that interference and it can do itself. It's pretty amazing, actually. And that's
Mhm.
the basic premise of healing. And actually, when you think about it, no doctor really heals the person. We take away the interference and then the body heals itself. That's true for any doctor. My dad is a surgeon. He doesn't really heal people. He removes the interference during surgery. So if somebody has a tumor or something, he goes in there and removes it surgically, and then the body has to heal itself. So that's just how it works. So
That's true.
but I think people need to be more responsible for their own health. They need to watch what they eat. They need to watch what they drink. They need to exercise. The whole
Yes.
purpose of these videos we do, in my mind, is to educate people so they will make better choices in life. And why when I go to other places around the world or even this country, people look different than they do in our area in the CSRA. In the CSRA, we have a lot of overweight and obese people. We do.
Mhm.
And why is that? It's a lifestyle, and it's a
Right.
not right lifestyle.
Excellent.
A month ago, I was in Colorado. I went and visited my friend that's a chiropractor there, and we did a little motorcycle trip for several days. And I'm telling you, everybody I've seen there is skinny. It's like fit. and people do a lot of things outdoors. It's a different kind of
Yeah.
environment, and it really is. So it's kind of like it produces that kind of, you want to do a healthy lifestyle and just go out. We can do the same thing here. We just need to be more aware to do those things, and
Right.
then on the political aspect, we should lobby to give us, for these politicians to give us things that are healthy for us. Like, why doesn't Aiken not have a greenway? How come we do not have a greenway in a beautiful city of Aiken? Not a
Mhm.
single greenway. North Augusta has a 7 mile greenway. We have zero. And, if you want to ride a bicycle or go for a walk, you're kind of limited. And Augusta has a little bit of a greenway, but, they're going to start working on that 15th Street Bridge fairly soon. And they're going to mess it up. And then the greenway kind of goes through that bridge. And then I think they're going to close access to that part of the greenway. So I don't know how that's
Mhm.
going to affect me, because I like to take my, e-bike there and ride it. So I don't know. We'll see. I mean, it'll be better once they finish the bridge, but I read it's going to take like 5 hours to, I mean, 5 years to do it.
Mhm.
So, we just don't have it. Colorado, if you've been to Colorado, but they got bicycle paths everywhere, and they are separate from car roads, not next to cars at all, which is
Right.
safer. And they all paved. And you can be riding a bicycle for miles and miles and miles, even between different cities over there, which is phenomenal. Florida, the same way. Florida, I go to St. Pete, and Florida has miles and miles of greenways, and there's a greenway that goes across St. Petersburg all the way to Dunedin. And I don't know how many miles that is, like 70 miles or something. It's like a really long. So how come other places have it
Yeah.
and we don't around here?
Yeah.
We
It's
need
good to
to,
promote that.
yeah,
To
we
promote
need
the
to urge our
prevention.
politicians to give us a way to exercise and stay fit, and not just have McDonald's and all these fast food restaurants in every single
Food
corner. I
deserts.
Yeah.
Yeah.
mean,
It's the environment. Remember, the environment creates
Food
circumstances,
deserts.
and the
yeah,
circumstances
it's
create these
it's crazy.
behaviors.
Yeah,
And
not
so, yeah.
So,
yeah,
Dr.
nothing
Dan,
against
you're at.
those businesses. I mean, I wish they're successful and everything,
Mhm.
but I'm telling you, other places don't have so many like we have, and I think that's not right. I mean, I go to Canada. My brother lives in Vancouver, Canada. They have a McDonald's too, but they got maybe 1/10 of what we have.
Right.
So, why do we have so many? Shouldn't people learn how to cook a little bit on their own? I mean, go buy groceries in the grocery store. It will be less expensive. You will feel more accomplished to make your own food, and food will be better quality than just going to buy burger and fries every day. Don't do that.
And
Make your own food, or if
yeah.
you cannot make it during lunchtime, make it in the morning. Make a sandwich or something and bring it with you and eat it. I mean, make an effort. Make an
And
effort.
again,
Right.
and again, that's
Yeah.
political driven too. So all you have to do
Yes.
is look at the communities and neighborhoods that
Hmm.
they're in. But Dr. Dan, listen, we're
Yes.
coming up on that time where we have
I
got
know.
to go. But this is always good when you talk about the
Yes.
history of the
It's fun.
spinal and of chiropractic. There's some other things that you didn't bring up, but maybe we'll talk about it on
In the
another day.
future,
How
we
how
only got so much time.
you tell us about somebody fell downstairs or something. That was the first
Yeah.
adjustment, or something had happened to somebody.
Yes.
They kind of
Yes.
just stumbled on chiropractic care. But listen, that stuff was good. Go ahead and give us your final comments, and we're going to close it out.
Well, I hope everybody's safe after the storm, and we can rebuild what we need to rebuild. And don't forget to rebuild your health. Health is the most important. Materialistic stuff can be replaced, can replace your health. So take care of yourself. That's the most important thing.
Awesome, awesome.
Absolutely.
And
Mhm.
again, if you want some chiropractic care, Dr. Dan is your man. You can reach Aiken Chiropractic at www.aikenchiropractic.com, or you can call their number at 803-641-9111. Again, Dr. Dan, thank you so much for joining us on today.
Awesome. Thank you for having me.
All right. Be safe. Okay. Talk to you
You
next
too.
month. All right. Bye
Uh-huh.
bye.
Bye.
Bye bye, Doctor. All right, that was awesome.
Yes, that's a lot. I was actually, Patrick, looking up that clinic while y'all was talking, and
Mhm.
it was like they took the materials, all the stuff that was in there, and they wanted to preserve it
Mhm.
and preserve the history. So they actually took all the material out of there
Okay.
before the building was demolished because it was full of asbestos.
Was it like a museum somewhere?
Yes, so it's somewhere in a museum. So I ain't get to
You reading it? Okay.
reading all of it, but
Good stuff.
isn't that amazing
Yeah.
how chiropractic is
How it
associated with,
evolved over the years.
but how
Yeah.
is associated with holistic care.
Oh yeah, yeah.
How it
And it didn't get the support that it should get
yeah,
because of
because
that.
it wasn't no money in holistic
Right.
health,
Doing things the
natural way.
yeah.
Okay.
Helping the body to heal itself, like doctors say, those
Right.
taking those interferences away. And the thing about medication, if you got to take medication,
It has its place.
it has its place.
Yeah.
And if the doctor prescribes it, then do what you have to do. But your body can get hooked on those things. There are side effects of medicine. We all know that. And your body can get used to the medication, and it will not do sometimes the thing that it's supposed to do naturally because of the medication.
All right.
So we all know those things, and those are called side effects. But listen, we hope that you gain something out of this podcast on today, as Dr. Dan talked to us about the historical aspect of spinal health care. This is Spinal Health Awareness Month, and it is also Breast Cancer Awareness Month. So be aware of that, and keep that in mind. But listen, we like to thank you for listening to us right here on Health Matters. We want you to like our Facebook page at Get Fit with Jackie Fitness, and subscribe to our YouTube channel at Health Matters Jackie and Coach.
Guys, remember, we're here to help you to become a better you, to be the best you that you can be. We always like to leave you with 3 John 2. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prosper. Guys, you have a healthy and blessed day.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, baby, that's a lifelong dream goals.
Health matters to me.
Yeah, health matters, and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.